consultant with Children's Autism Services at Edmonton, and he served on boards as well. And he's also got a Bachelor of Science from psychology and neuroscience from the University of Alberta. So take it away, Simba.
Perfect. Thank you, everyone, for having me. So this is my first time recording in person in 3 years, and trying to wear pants to do this paper is very difficult. My name is Simba, and today I'm going to be sharing with you our new technology that we've been working on the past 2 years that aims to help mental health using data for virtual care. When we look at mental health problems, I think following COVID, we've heard that it's becoming a significant concern. But did you know that every single year, 1 in 5 Canadians are diagnosed with some form of mental illness? And by the time we are 40, 50% of Canadians will have had or will have some form of mental health impairments. If the emotional cost to the person suffering from these mental illnesses is not enough, from an economic burden, it costs Canada in excess of $50 billion. We believe the solution to solve this comes in 3 steps. The first is to improve monitoring, not just for people with mental illness, but overall lifestyle monitoring. The second, to support early detection of mental illness, not from a necessarily clinical perspective, because there's a lot of great research that's being done for early detection of Alzheimer's, and they tend to be a little bit more in the medical field, but to see if we can do early detection leveraging consumer technologies such as wearable devices, and use maybe secondary measures such as stress and sleep patterns to see if we can use those to determine if a person is at risk for developing mental illness. And finally, improving virtual treatment, utilizing cost-effective technologies that will help timely administer mental health treatments, especially to our rural population. So what have we made? We have created the Lenica Health Platform. And this platform has got 2 areas. On one side, it's a data integration platform that allows clinicians to collect data from any wearable device. We haven't gotten all of them yet, but we're working on building more of the technologies onto our system. And on the other side, it allows clinicians to package their treatment plans to suit each clinic, to suit each patient's needs. And so I'm going to show you the 3 main features and exactly how the system works. So the first feature that it allows for remote data collection. When I used to be a behavior consultant, I'd see my clients once every single week. And I knew that between those sessions, a lot of information was being missed because my clients would tell me, oh, we're doing good, right? I'm sleeping well, I'm not stressed out. But then when I would look at them, I would see that they were stressed out, they were not doing well. Or I'll hear reports from maybe their school that they had a meltdown, something was not going on. And so being able to collect that remote data objectively and automatically will provide clinicians with additional information that can inform the treatment that they're providing with the intention of improving not only adherence, but clinical treatment outcomes as well. The second feature is that the system is hardware agnostic. So whatever wearable devices are available here, Apple Watch is one of the integrations we have. Health Gauge is another integration that we have. We have an Allegory EEG-based system that we've just integrated as well. We're able to leverage any of those systems onto our platform. Now, in 2020, we actually had to rebuild our system. For those of you that know me, you know that we had a VR system that we're working on for a long time, but apparently athletes could not play the sports during COVID. So we actually had to rebuild our whole system from scratch. So the essence of the technology is a data integration platform that allows us to integrate any system within 4 weeks based on the clinic or the clinician's need. And then finally, the automation of therapy. And I'll show you that a little bit later, so it makes sense. So basically, how does it work? It allows clinicians to create and assign any questionnaires. There's a lot of validated assessments out there that we realize that we cannot create our own or try to kind of figure it out. So we allow clinicians to create and assign their own questionnaires, measure and monitor biometric data from whatever device the patient is using, schedule customized text messages. These could be reminders, inspirational messages, or one clinician is using the patient's caregivers to write text messages they'd like their son to get. And then we are now automatically scheduling them so that the son gets those messages on a daily basis. You can do neurofeedback data collection, assign videos either from YouTube or private videos that could be therapy sessions that could help support those in-between session therapies, and then provide therapeutic homework, which is most people don't do their homework, and in clinical support, most patients also don't do what they're supposed to do. So how does it work? Our system kind of looks a little bit simple, but it works perfectly. Clinicians are able to basically create whatever resource that they want. They can create their forms, they can connect to YouTube videos, they can have their private videos, or they can create log tables, which is basically a table that could be anything they want to collect. One of our current clients utilize the log tables for adverse effects, medication logs, and other conditions that their patients might have. And then they're able to take all the resources that they create and basically program a session, whether for a specific client or for a specific group of clients. And the way it's done is that under the tasks, all the resources that they've created, they simply click on them and then they become assigned. And then they'll create a deadline from the start day of that treatment, and then also schedule custom notifications. Now, if let's say you had come into the clinic, I'm your behavior consultant, and we are starting this at, let's say 3 p.m., I go into your patient profile. From the load with preset, I'll actually select the date and the time for that, and it will automatically populate that program session. I click save, and then on your own secure dashboard, all that information that we've loaded up is automatically assigned to you. And then if that text message is associated with it, then based on the schedule that you programmed, those will also automatically be scheduled for the patient themselves. There are different views. Of course, this is a little bit more of not it's a simple view, but we also have a calendar view that we just added recently based on the request of our current client. Current market validation is when we look at the CDC between 2020 and 2019, there had 154 increase in the use of telehealth services. MediBio raised $40 million a few years ago, which utilizes data, a biometric depression assessment, and that kind of shows that there is an interest in terms of investors in similar technologies. Finally, our current platform was used in clinical trials to work with with patients suffering from persistent depression to try out a new clinical modality utilizing the programming that I just showed you a little bit recently. Our target market is primarily clinicians and small clinics, and these clinicians are looking to find ways to, again, get more information about their patients, as well as automate some of the services that they are providing to their clientele. How do you make money? Which is a question that seems to come up quite a bit. Our current pricing model is we charge individual clinicians $99 per month, and we did this based on looking at what our similar competitors were charging for each clinician that they were using their software with. We also have a small group package with up to 5 clinicians, which we charge $350 a month. And finally, we offer an enterprise service in which we customize our system so that if someone has got a specific therapy modality that they want to be preloaded and utilize it in our system, then we are able to do that. And we are working with a company in the United States right now to package their service. Fraction, as we said, in 2020, we had zero money coming in because sports stopped and we had to rebuild the whole system. And since then, we've been working on rebuilding this platform from the ground up with having a few sales in 2021 and just over 40,000 last year, which was around that clinical trial. This year, functionally, we know that our system works. We need to make it look a little bit more beautiful because that's kind of the feedback that we've gotten from some of our early users. But from a functional standpoint, it's a very, very robust system. Our go-to-market strategy is pretty simple right now based on the resources that we have. So a lot of it has to do with utilizing LinkedIn to find clinicians that would be interested in our technology, as well as attending conferences and events to share and shout about what we are creating, like this one right here. When we look at the market size, we basically looked at all the number of mental health clinicians that were in Canada, based by the CIEHI.ca, and there are over 750,000 mental health professionals. Multiply this by our annual cost to our program, it goes up to just under 800 million a year in terms of the potential market that we could access. And this is just in Canada alone, so we're not even talking North America or other parts of the world. When we look at our direct competitors, what is unique about our system is that we do everything, but our competitors do all these different components in isolation. So MidJane is one of the companies that have been coming up a lot of the times when we're talking to a lot of our clinicians. It's an EMR-based device which allows for scheduling. You can do assessments on it, you can do charting, but it lacks any of the biometric capabilities that our system offers. Human API and Thrive, those are basically data integration centers as well, which allows insurance companies or clinics to be able to integrate data from different wearable devices. What is different from our system is, again, they don't necessarily have their own dashboard, and they tend to target the insurance market as opposed to us, where we have our own dashboard, and then we also leverage other data sources such as the forms as well as the EEG-based devices. Jot form or type form, those are pretty self-explanatory, but our system does exactly the same thing. But again, it's all done within a secure single platform. And finally, Text for Hope, which is a scheduling message, which is very, very amazing and sends you consistent text messages for your mental health. What our system does is that it allows you to customize those messages for each specific client or group of clients so that it actually meets their needs. Our team consists of, these are some of the teammates, there are quite a few other people, but I figured didn't want to bore you with that. Myself, I've spent 7 years as a behavior consultant, working with kids with autism, OCD, different psychiatric conditions. So I'm biased to know that this system, I would have used it if I was still working. Our CTO is Eric Mann, who is like a savant of a developer. He tries to explain what our system does, and if you ask me those questions, I'll probably have to refer to him. But basically, we've got a very powerful engine with 2 databases that we utilize to increase security, and we are also HIPAA compliant, which was a fun process to go after. Lenica, her experience is in stroke rehabilitation and background is in neuroscience, currently working at the U of A. Dr. Lu, he's working in the Department of Psychiatry, and his expertise in machine learning and creating mental health assessments. Scott Phillips, he's got a lot of experience expanding companies globally, and is one of the connection between our current clinical trial partner, who was able to work with us to get that partnership. And then Cliff Neufeld is our business development expert, who's made sure that the system that we're developing actually solves the problem and doesn't have all the cool features that we really wanted to have. So what are we focusing on right now? Number one, the UI design. As you can tell, our system looks pretty simple, and we have heard it multiple times, but it works amazing. And the simplicity of it, we believe, will help with adoption, because that's kind of the feedback we've gotten from our early users, that it's a little bit complicated to set up, but once they are set up, then it's pretty easy to implement. Of course, increasing our marketing and sales, what we are doing is enough, but it's not quite enough because we're not as aggressive as we could be. As I mentioned, it's a data integration platform, so we've been asked to include Fitbit and Oura Ring and all these other components. We plan on adding those as soon as we've got more sales. And finally, scaling internationally. Most of our clientele are in Canada and the US, but we do have plans to make sure that the system is actually going to be used in Europe and other South American countries. Our ask, the first thing is mentorship. The commercialization has given me more gray hairs than I care to admit for my age, particularly in commercializing digital health programs in the healthcare industry. The second thing is introduction. So we are looking to work with mental health organizations that are looking to leverage technologies to facilitate their services. There's a few that we are in talks with right now, but with large organizations, of course, it takes a little bit of time. So we are meeting with the clinical team, and then we have to meet with the executive team as well. And finally, we're looking for 750,000 to support with that future roadmap, particularly the UI elements, because as much as I'd like to say it's just making the front end look good, I've learned that when you make the front look good, you might need to change a little bit of the things underneath as well. So it will cost a little bit more than is required, but then primarily a lot of that money is going to go into marketing and sales. Perfect. Thank you everyone for listening, and I'm open to questions.
All right, we'll open it up to questions right away.
Can you tell me, what are clinicians using right now? Like, who are they gonna have to fire? Or are they gonna have to fire somebody to, start using your product? And, you see that, what has been the feedback so far? Like the ease of transition, or that, everybody, leans towards the, easiest option. So kind of talk about what you've learned so far and, what you're gonna have to get conversion to get rid of.
Absolutely. Our biggest thing that we are fighting against is status quo. Right now, clinicians use basically pen and paper. They're comfortable with that, it's tangible. They're able to file it, it's secure. And so when we talk to a lot of clinicians, particularly psychologists, they're like, wow, this works. Why would I put my item or my stuff on the system? And so that's been the biggest thing that has been the barrier to adoption for us. And then, of course, in addition to that, because the system is not as user-friendly as we want it to get, it's almost like they find it too complicated to set up. With the clinicians that we set up the system for them, there's been a much smoother transition, but then the cost of adoption then becomes significantly higher. So we really want to make sure we streamline the onboarding process. And some of the ideas we've talked about is creating a library of assessments, for example. So all the assessments that they utilize, they don't have to create those assessments. Creating templates for some of the therapies. So if they use CBT and there's a sequence that is already been validated, they're able to preload that specific sequence onto the platform without having to set it up from scratch. So the onboarding process has been kind of a sticking point, but status quo is kind of the big thing.
So, you say we want to start running back on all this. I really want to think about getting a slide in there that explains to me how you increase my cash flow by more than $99 for adopting your technology. Do I either lower my cost by being able to fire somebody? Do I get more bums and seats? Can I put more people through my clinic? Tell me how I get my $99 plus 1 penny back.
Yeah.
As a clinician.
Precisely.
And you need a slide in there about that as an investor. I want to know that you're able to add value, that so I can get paid too.
Precisely.
Yes. So that'd be a great slide for you to explain that.
Okay.
You don't need to do that. That's
Sounds good. I was already like formulating a response.
It's a hard response. Could do a slide like that.
Precisely, absolutely, yeah.
So my wife is a psychologist. We often talk about mental health and excellent education. Do you see a play here to empower a direct consumer? What if with the data, because I see a huge play in data, if you can get the data from a Fitbit and Apple Watch and other devices and actually tell me, hey, Ali, something is wrong. How do you see a play there, or do you still see it in the B2B space? That's
So that's a great question, because we have been discussing whether to replace kind of that feedback that a person might be getting from just automating some of those baselines or the benchmarks. And so what we have discussed is making it a little bit more clinical, clinician-led, because at this point, I think even if the person's got a Fitbit, they can be empowered by connecting their Fitbit into our system, and then have a clinician be able to monitor and provide that clinical expertise to be like, hey, if you notice this, this, and this, then that will end up flagging that you need to sleep more or you're becoming more burnt out. A feature request that has come up was to be able to actually go into the data that is being collected and be able to flag different nodes. So we won't flag it, but like your wife as a psychologist could be like, okay, if you notice that your sleep dropped below 6 hours, flag this and send this message. And for someone, it might be if your sleep dropped below 4 hours. So there's a lot of variation. We want to allow for that flexibility. But we do see that the part for consumers is we want them to use the technology and devices they already have, so they don't have to do necessarily any extra work, and it suits whatever lifestyle they have and whatever lifestyle data sources already been collected.
We're at time, unfortunately, but do feel free to connect afterwards. Thank you very much for the presentation.
Sounds good. Thank you. And thank you, everyone.
I wonder, like, who owns the data?
We
You guys, yeah, that's a big part of it, right?
Yeah, and I think even like usually an IP question comes, like the biggest thing is like data we're collecting and what we do that because it's all multimodal, unlike Apple. They collect all that. And then also it's like the multimodal component that makes it like.
But that's why I mentioned hire a person, right? As well, right? Like, I mentioned if it helps states.
And that we're gonna have a lot of
Whatever, so you're not. Like, there's a lot more time.
We actually, last month, we are talking about it. Was. I've never been so excited. Like, but yeah, there's like a lot of, but I right, like, why stuff, like, I don't know, I hope you. Thanks, it's.
Maybe you can give me that one more time. 'Cause I'm recording on the one computer.
Oh, you can down.
Well, I could download, or I could. Yes. The people who aren't in the want to see the show. And so they sometimes like it's uploaded. So if you don't mind, downloads and then copy down.
Yeah.
There. Yeah, maybe, can we do a 5-minute break?
Yeah, can we do a 5-minute break? I'll put my coffee control. We'll come back and reconvene at, maybe 12:55 or 2:15. That I do.
That's it.
Okay, yeah.
Site plan.
2 minutes. Okay, so that's good. And I think I still have the thing running, so let's make sure that's good. Because now I'm gonna have a problem here. I've got to record over here. Hello there. Oh, we're still recording. That's beautiful. Great. So if I go here. Okay, so we're gonna be recording the Zoom session here, if that's okay, and I will. No, I'm good. Sorry, I got it. It was just too many cables. Right? Let me give that back to you if I can again. And then there is a, he's running a pointer. Maybe I'll just watch your body language and I'll go forward for you.
Okay.
But let me just see, this might actually work. Because, oh, so I did this thing out. This you might just get lucky.
Oh,
I think she gave me this instead of this. But I'll talk to her. Maybe leave this here.
Michael, yeah, you can change the slide.
I'll just change for you because I think that might be simple. Yeah, okay. Go through a lot of here, so I want to make sure you get some of that. Might go a little later, but I'll try and wrap up by 4:30 at least. Okay, so I'll just make sure we're good to. You're okay. Thank you. Thank you for your understanding. We are now, I think, ready to roll. Okay, back.
Okay, so it's my pleasure to introduce Michael Weinfeld, who's the Vice President, CSO, and co-founder of WWiKY BioSciences. And they're seeking $5 million USD to complete phase 1, phase 2 trials, and he'll talk more about his technology. They have received Health Canada approval for phase 1, phase 2 trials and have patents that have been obtained from the university. Michael is also a professor of oncology at the University of Alberta and is also a senior scientist at Alberta Health Services. So take it away, Michael.
Thank you very much. Well, I don't need to say much more about the introductory slide, so we'll go on. So what I'm going to be talking about today is cancer, as you may expect, since I work at the Cross Cancer Institute. And there's no doubt that the number of cancer cases continues to increase. And despite advances, continuing advances in improved therapy, you'll notice that still around half of cancer patients succumb to the disease. And we know that
that one of the major causes for resistance to therapy, chemotherapy, radiotherapy, and immunotherapy is something called tumor hypoxia. These are regions within the tumors that have low levels of oxygen. And in those regions is where the cells that often resist the therapy reside. They also propagate and form metastases. And although we've known about hypoxia and the problems of hypoxia for many years, for decades actually, there still has not been a really effective way to deal with tumor hypoxia. So this is where we think we come into the picture. WWiKY is focusing on hypoxia, developing reagents for both the laboratory and the clinic. So what I want to talk about today is a radiopharmaceutical called hypoxin 1. What is a radiopharmaceutical that targets hypoxia? It's composed of two key elements. The first is a chemical component that only allows the drug to bind to hypoxic cells, which is great because almost all the other cells in your body are nicely oxygenated. Hypoxin 1 won't stay there, only stay in the hypoxic cell. The other key element is that it is attached to a radioisotope. So what does a radioisotope give us? Go to the next slide. Two things. The first is it allows us to diagnose the patients who have hypoxic tumors. And that's great because the patients who don't won't go on to the therapy. So there's already a great saving and great precision in just targeting the patients likely to benefit. If you compare that to conventional chemo, where patients get more or less the same regimen, there's no selectivity. Here, right from the start, we know which patients are likely to benefit. This picture just shows you a lung cancer. This is a CT scan. And what you see here is hypoxin 1 going only to the tumor. All the surrounding tissue, all the normal organs around the tumor, the hypoxin 1 does not stay there. Okay, it flushed out of the system. So that's the first thing. The next thing is we can, if we up the dose, once we've identified the patients, we up the radioactive dose, we can use this same molecule as a therapeutic. The high level of radioactivity will kill the hypoxic cells in the tumor. So this is a process that now has got the term theranosis that combines where a drug can be used both for diagnostic and therapeutic purposes. Okay, and the other nice thing I should just mention is that this approach will also target the metastases, not just the primary tumor. If the metastases have hypoxia, which they often do, then we can target the metastases. Okay, let's go to the next. So where are we on the long pathway to get things from the bench to the clinic? This is just a listing of all the milestones we've gone through. I'll only point out a couple. One is that we've developed the process for GMP manufacturing of the radiopharmaceutical. We've also done a fair amount of work with the drug as a diagnostic. Over 70 individuals have been injected with hypoxin 1 to identify patients with tumors, and we come out showing about 40% of patients who present at the clinic will have hypoxic tumors. But the most important thing, as was mentioned early on, is that we now have approval from Health Canada to carry out a phase 1/2 clinical trial. The only thing stopping us right now from carrying it out is the money to do it. The team is in place at the Cross Cancer Institute. We've worked out other components like who will manufacture the radiopharmaceutical, but what we need is about 5 million to carry out this clinical trial. But we've actually also thought beyond the phase 1/2 clinical trial. Obviously, if if this is ever going to get into the clinic, it's got to clear phase 2 and phase 3 clinical trials. These are multi-center clinical trials. Our clinical trial will only involve 30 patients, but when you get onto phase 2 and phase 3 clinical trials, you need a lot more patients. So go on to the next slide. We have reached out already to other centers, cancer centers, that have much larger numbers of patients that will increase the chances of getting good numbers for the clinical study and shorten the time to get the data. So the Christie Hospital in the UK is one of the largest cancer centers in Europe. We have another major center, in Lucknow, India. And most importantly, is this hospital in China. And in order to further push our clinical trials in China, we've actually set up a partnership, a new company with a Chinese group. So that looks like it's well on the way to getting the phase 2 and phase 3 clinical trials off the ground. Now, the clinical trials also have implications for investors, especially early investors. And what I've put up here are some recent deals of smaller manufacturers, smaller radiopharmaceutical companies, when they've gotten through mainly the phase 1-2 clinical trial, actually being bought out, being acquired by much bigger pharma. And you can see here what amounts we're talking about. And these deals were carried out before the phase 3 was completed. So it means that although it might take 9 years, 8-9 years to get all the way through the process, often the smaller radiopharmaceutical companies are acquired by big pharma. So that's an important, I think, consideration for any early stage investor. This slide, I just wanted to show you a current radiopharma that's being used in the treatment of cancer. If you look at Lutathera, for example, which is owned and operated by Novartis, generated by Novartis, it treats actually a fairly rare tumor, just these neuroendocrine tumors. But these are the sales from 2022, almost $500 million. This is the cost per treatment, per dose, about $60,000. And a patient usually gets 4 doses of Lutathera. So this just gives you an idea of what we're looking at. So what does this mean in terms of prospects? Yes, for market projections for hypoxin 1. In this case, we've taken a very conservative look at things. We're saying, considering if only 0.5% of patients in the US, cancer patients, are treated with hypoxin 1. So there are approximately 2 million new cancer patients each year. And if we set a price of about $7,000 per dose for imaging and about $100,000 per dose for treatment, then, next slide, these are the numbers we come up with in terms of sales, which kind of astonished us, to be perfectly honest, was that just the diagnostic side would probably generate $200 million, and the therapeutic side would be about $2 billion. That's just treating 10,000 patients in the US in a year, okay, which is only 0.5% of the cancer patients. So what are we seeking? Well, yes, to carry out that phase 1-2 clinical trial will cost us in the region of $5 million US. I know that seems like a lot of money, but not really from the point of view of a clinical trial for a radiopharmaceutical. Just the manufacturing of the radiopharmaceutical will cost us over $3 million. And that's through a company called Atom V, based in Hamilton, Ontario. Okay, we do have a pipeline where we're developing other reagents to target hypoxia, and we have 2 other reagents that we think are ready for marketing. Anyway, this one is a lab reagent, and this one is a precursor for making radioactive hypoxia 1. Yep. This is our IP portfolio. Importantly, we have acquired all the IP from the University of Alberta now, so it belongs to WWiKY. And as you can see, we've filed patents in many countries across the world: China, UK, United States, Europe, etc. And we currently have 1 full issued patent, US patent. This is the team. It's led by our team's led by Dr. Kumar, who is currently actually in Lucknow, negotiating with the hospital there. Dr. John Yao, so she's sitting in the audience right now. Myself, we're all scientists, chemists by training in the past, but we have a strong advisory team. Dr. Michael Sawyer, who's a medical oncologist at the Cross Cancer Institute, and who in fact would lead the clinical trial. Dr. Naresh Jha, who's a radiation oncologist. Dr. Len Weeb, who together with Dr. Kumar really carried out the science behind hypoxia 1, and Dr. Sharon Barker, who has worked for many years for Johnson & Johnson, has helped us out on the business and investment side. So I think that's it for now. To answer any questions you may.
Do you think you're focusing a bit too broad? Because if you look at kind of the different levels of treatment or standard of care for something like breast cancer, it's got a very established pathway of many players and diagnostics, versus focusing on a subset that, let's say, had very poor phase 2 or phase 3.
You're absolutely right. And for the clinical trial, we're focusing only on lung cancer and head and neck cancer. Head and neck because radiotherapy is the usual treatment, and hypoxia, well, actually hypoxia is prevalent in both. But you're absolutely right. We're only focusing right now on 2 cancer sites.
I presume you would have to actually fabricate the final medication on site.
No. The nice thing about iodine is the isotope we're looking at, I-131. That has a half-life of around 7 days. So if it's manufactured in Hamilton, it FedEx, I mean, you know, it's easy to transport and would get to us within a day. So that's not, yeah, no, we're not talking, you know, some other isotopes like fluorine have, you know, you're talking minutes, but here we're talking days. So that's not an issue.
So that if that's the case, then I presume you considered how it is metabolized or excreted.
Yeah, so it's mostly excreted it's metabolized and excreted in the urine. We have to pre-treat the patient with cold iodine to protect their thyroids. So that's a standard procedure. And yes, at the Cross, for example, you know, thyroid cancer is treated with iodine as well. The facilities are there. The washrooms are there because you're going to be peeing out radioactive iodine. So that's the hospital's used to handling that isotope. So
How are you waiting for that by? How do you should tell the room how you want your money.
Okay, no, that's
That's what
yes.
say about it.
Okay, yes, no, we are, I can tell you, we are totally open to full discussion on this. You know, what we want to see is to get this clinical trial up and running, because that's the only way in the end is going to get to the market. So we would enter into negotiations if people want to invest in the company as and take a percentage of the ownership. We're depending on the amount that the investor would put in, we would definitely be very open to that. That's not an issue for us. So,
Let's talk after.
okay, no, we honestly, that's what's like,
I've got a question from the Zoom chat from
okay.
Aditya from Admire Bioinnovations. One of the issues with targeting hypoxia has been ensuring the drug actually reaches the hypoxic regions in the solid tumor. What's your strategy for achieving that?
Okay, so I think I showed you already, because the diagnostic, which is a low level of radiation, will tell us already, is it getting to the tumor? It'll only light up if it gets there. And the nice thing is that, especially also because it's iodine, after 24 hours, all the non-binding radioisotope is flushed out of the system, and basically it will only remain in the hypoxic region. So even if it's not getting that much, but we'll be able, the other nice thing I should have mentioned, from the diagnosis, we can actually do the dosimetry.
Okay.
It's exactly the same compound. In fact, in terms of the total amount of hypoxin 1, it will be almost exactly the same amount of chemical for the diagnosis as for the therapy, but just a much higher percentage will be radioactive for the therapy. So if the drug doesn't get to the tumor, then the patient won't be treated, because we'll know from the diagnostic whether it gets there or not.
Sorry, this person has one more question if I can, because I want to just gauge Zoom.
Sure, sure.
So Aditya asks, for patient certification, are you planning to leverage the radiobiology aspect of hypoxin 1 before commencing treatment? For patient stratification, are you planning to leverage the radiology aspect of hypoxin 1 before commencing treatment?
I'm not quite sure what.
So we don't quite know. We're going to move on to that question, please.
So what sort of efficacy did you see in your animal models in terms of tumor shrinkage or?
So, in I have to say that we're in the process of actually still doing that. What we know, okay, the reason why Health Canada approved this is because we've already tried it as a diagnostic in about over 70 individuals, many of whom were cancer patients. 9 of them were volunteers. Actually, we've looked at, if you under cardio conditions, because again, that might increase hypoxia somewhere. That didn't happen actually. But the other thing is, we know from other radioisotope, other iodine-containing drugs, really the amount of isotope that we need to get into the tumor to be effective. So there are other drugs, MIBG I had up there, which is an iodine-based drug. And on the basis of that, we can say, yes, we need to get so many millicuries into the patient to achieve this amount of targeting for the tumor. So, but we are right now in the process of doing more extensive animal studies, and that'll be important, I think, for the US.
I think that's important for your investors to
Yep,
see that.
I-
I mean, I agree with your statement that high levels of iodine should do that, but the proof is.
Yep,
like biology, so.
I totally agree.
I think we're out of time, but thank you very much. Thank you, Michael.
Okay,
Appreciate it.
thank you
Thank you.
very much.
Waiting for a 10-minute break now.
And also Chaneel will also say he's waiting outside.
Perfect. Okay, guys, just a short break. We'll do 5 minutes if that's okay. Then we'll start maybe 10 minutes. Are you guys okay with 10 minutes? We'll go a little bit over today, but if you guys are okay with that. Okay. Yeah, all right.
No, I don't think
How
so.
do you know Mike Wicker? I thought I saw you knew Mike Wicker. Hi there.
Oh, yes, because I was working with innovations.
Great.
Oh, okay.
Great. So
So
you have
I
your
think this
desk.
company was one of.
You want to present on your?
Okay, so through projects.
Yes.
Okay, no,
I can copy that over here.
Oh, okay.
So I saw you, Mike.
Like a movie?
No, yeah, because, yeah.
Let me just.
I think his venture was.
It's here.
Yeah, probably was. It's
Right.
Yes.
No, that,
Yeah.
that answers a lot of questions.
No worries.
Just back to you.
Yeah.
That is the cutest USB I've ever seen. Well, that's all right. As long as you're wearing it. Oh, yeah, yeah. Actually, we're gonna collect them. If you just initial or. Okay, cool. I can also take them here. We, are you taking that?
Yes.
Okay, well, thanks for your time. Well, thank you. I mean, I think, yeah, people have got a lot of. Well, he's there, feel free, well, they're in town, so you can always talk to them basically, but,
And if you are free sometimes, this week or next week,
I'm actually gone for 5 weeks, unfortunately.
okay.
Yeah, this has been a crazy month. I just got done teaching in 2 grants, 2 conferences, and I'm taking off. But I will be on Zoom if you want to chat. I'll be in Europe though, so.
Just talk when you're back then.
Yeah, I mean, if you just do reciprocal, that's easy, because I'll just, you know, that's the simplest.
I'm okay with sponsorship though.
Yeah, well, that would be cool, because our next event's gonna be on May 26th.
Yeah, it's very busy.
Big one.
Okay.
Diagnostics. It's gonna be a fun one. Yeah.
Thank you so much, Michael.
Well, thank you for coming, and give my regards to Ron and the team, and thanks for coming by, and thank you for helping support these guys, and, yeah. Thanks so much.
Take care.
Okay, great.
Great, well done.
That's true. Somebody's getting there.
Oh, I didn't see that. I don't.
Yeah. Because,
Yeah.
we want your, the biggest stuff I guess.
Oh, I see. It's a music clicker.
Hi there.
Clickers there.
Thanks for coming back. I appreciate it.
You're good.
I just copied, I didn't see a video for yours. Do you have a video?
No.
Okay, you just kept it simple.
Yeah.
Cool.
I kept it simple.
That's
I mean,
okay.
I have a hard enough time getting myself to be simple, right?
Well, we'll see. We like complex, but we don't always get it right, so
So to move this forward.
I just, I'll watch your body language. Give me a signal on your forward. I do have an advance, but I'm having trouble with my advance.
Okay, if I go like this,
Yeah,
then,
yeah, whatever.
then.
Yeah.
Like I have only 2 slides of animated, so there's one that I'll
If you
just click
just
twice.
Flick a finger up or whatever, or flick a finger down, I'll watch.
All right.
We'll get there.
Hmm,
Oh, okay, yeah. It's a MP4.
Yeah.
Cool. Let's just see how this goes.
Yeah. It's all. Yes, yeah, absolutely.
Well, we're fine, but we actually we had a bit of technical difficulty getting this networking.
Yeah, it's
I
been
tried to get a
recorded.
wire. So. anyway,
right there.
Yeah, that's the camera. But that's the camera for seeing the screen and the whole
You
thing.
you get what you're looking at.
They're seeing so much.
Sometimes, yeah, we do different venues. And we'll get there.
If I do a proper house, so that's nice.
No, it's all, they can. Yeah, this-
Can you just forward through this? You have to make sure you're good with it. Okay, and I've got yours.
It did think of the long term. You are not here to fire.
That's all good. Yes. That's, yeah, I'll be interested to see. I'm sure it's different than most. Yeah, it's interesting. So like you have your own like different amount of yes. Yeah. Oh, so this is more of a this is okay. Yeah. Right. Right. Yeah, it was good.
Oh, nice to meet you. I'm not. What's that? Yeah. So we have like a program. Companies, whatever. Then they hire people like me. Tech scouts or like companies, see what's out there, see what assets we have. And that's one of our clients. No, I don't know.
Okay.
But I will.
What data?
Yeah.
I'm not even sure.
Yeah.
So.
About yourself.
Give it forms that you can upload and make it available. We will upload this. Okay. And then you get the full later the problem. And you're right in this one. Okay. Yeah, that's fine. I mean, we'll share the video. Make some sure you support it. It takes time. And you do a lot of work. Again, yeah. They're also, of course, walking over the back. Maybe make 2050. Yeah, it's on the website. Yeah, you can register. Also, all of this content, and it's something that, you know, I own signs. So I think
yeah, so you know, the international company will come to us. They were having trouble in like our water management or like companies that have solutions for problems, then we did it. So a big part of my job is kind of checking it out, seeing what's out there.
Excuse me, is there a workshop I can use? Yeah, for sure.
I really actually always wondered, like, I always wonder, like, honestly, like, when I tell like my family and people know that I work at BBC, that they work BBC, right? But as far as like ground part, whatever, just kind of what we do, whatever, I find it's pretty limited knowledge. Yeah. But especially like in clean tech, so much stuff going on in Western Canada, and so I want to try to like kind of promote that stuff a little bit more and push Canadian, like Western Canadian. How long have you probably about a year. Previous that was at STTC, which is like a Sustainable Development Technology Canada, which is like their branch of early stage transit. And so part of the reason I moved over to EDC was the next one companies that I was working with were kind of early stage, and I wanted to see what it looked like from a global marketplace perspective and how they're interested. How about yourself? How's BJ?
That's good.
Yeah. How long you been there for?
About 6 months. So I came back from Toronto.
Yeah. Yeah, so when I think about like the logic, like some of
small and mid-sized restaurants. And I think for those law firms, I think it's a huge step for them. It's how else you're gonna find clients.
Yeah, very much.
You gotta go find clients. Find your city streets.
Yeah, just having a platform, right?
Immediately.
Right, like my sister-in-law and brother-in-law are lawyers and they're and like, you know, they're like going through the process that you're going through as well, which can be like quite daunting, right? And so I always tell them like, yo, man, like you guys should like check this out. You kind of run your own business a little bit more, right? Choose your clients and sort of go.
Do they want your law firms or?
They're basically like one to Tiki like Uber law firms, they're like kind of in real estate space or whatever. So my sister-in-law works for Ben Jones for I think 6 months and actually.
Guys, we're about to start. So are you guys okay in a minute or two? Anyone need a break or you can stick to go? I know it's a long day. I really appreciate you sticking around. And thanks for your evaluations. They're going to be uploading them. So if you have others, we'll collect them and upload the information. I'll just try and get the other troops in here.
Yeah, her name is Jeet Fairwell. I'm like this sitting very well.
Oh, yeah.
Did work, that doesn't work.
I've been down.
Lasted about 6 months, I would say.
And I've worked, yeah, then-
Yeah, she went to a smaller.
Thanks.
I guess I don't, you know, just joined, so. We took the work. Definitely not.
Yeah, and like, you know, I've worked in Calgary for a number of years, but yeah, I'm there.
Okay, guys, we're going to start the next session. Aaron is chairing, so thank you very much, Aaron. Thank you. Thank you for your form. If you fill it up online, that gives us, you know, we're very happy about that. It's easy for us. But the paper is also good either way. The data will be shared back with you. So Aaron, feel free to start our next session.
Yeah, for sure. Hi, everyone. My name is Arun Nair. I'm an associate with DiscoveryLab, and this is my first time sharing, so apologize for any mistakes. Our next company is an Edmonton-based company which has been around for quite a while, Pleasant Solutions, but their new product Sheetcast has been quietly making some waves in the Excel community. And what is Sheetcast? Sheetcast is an add-in which allows users to create web applications to make data analysis and other sort of analysis of your data easier. And they're already in the different markets like US and Europe. We have Jason Clarke, who's the VP of Sales, who's going to present the presentation. Jason, please.
Hello, everyone. Michael, do you mind if we start with that video file?
Sure.
It's got a little bit of energy, so.
Okay, so we're going to run the video just 2 secs here because this computer is about 5 years old. Here we go.
Yeah. Oh, except for missing sound.
Sound would be good. Yeah. Absolutely. I'm going to go back to the beginning. Okay.
So I wanted to show that video first. That was a video that we produced in-house. We have our own video production department, just to introduce the concepts of Sheetcast. Sheetcast allows you to build your own custom web applications with no more knowledge than your basic usage of Excel. So this is truly citizen development. There's about 750 million Excel users worldwide. All of them can now build custom web applications. I'm not going to rely too heavily on the slide deck, but I've got some speaking points to guide me through. The next slide. So our ask here, and you can go straight to the next slide, please, is perhaps a little bit different than the asks you've been having today. We aren't looking specifically for any funding. We don't do any equity funding at all, but we will consider non-diluted funding. We are open to those discussions, but we're not seeking that right now. What we are seeking is channel partners and distributors. Pleasant Solutions has been around a long time. We've got other products, particularly a product called Password Server that we've grown tremendously worldwide. And we've done that partly through these types of relationships. So the ask is channel partners and distribution relationships. What we're offering is 20 to 50% on licensing, 100% on services, and the services can be quite lucrative. And those are services provided by the partner. Services provided by us, we still provide a 10% kickback as well. Our licensing model, or our revenue model, is $12 per user per month. The thing to know about users is that's anybody that's logging in that requires a username and password to log in to use an app built with Sheetcast or to build an app with Sheetcast. Actually, if you just go back for this 1 second. We also have a $10 per column pricing model as well. The reason for the two different models is we want this to be as efficient as possible in terms of pricing for businesses to be able to adopt. So for example, if I was a research institute and I have hundreds of spreadsheets and hundreds of columns in each of those spreadsheets, I probably can't afford $10 per column per month. But I might also only have 3 people working on that research project. So I just need $36 a month, and away I go. I can build as many apps as I want to. The flip of that is perhaps I'm a distributor. I've got hundreds of clients. I want to build a portal for them. They all have 2 or 3 users that need to log in. I can't afford the $12 per month, but I'm only sharing 15 columns of data with those clients. So now I've got $150 a month. So we've worked really hard to keep that pricing model such that it is scalable and affordable, even for small businesses. On the services side, the way we implement Sheetcast, we work with the client to understand their first project need, help them build that first project, which includes some organic training of how to use Sheetcast. Sheetcast's got a very low learning curve. And typical implementation fees are dependent on that client's project, but between $5,000 and $20,000 is typical. And this often equates to, because of the ease of use and the speed of building an application with Sheetcast, often equates to over $1,000 an hour. So a little bit about Pleasant Solutions. We've been in business for about 15 years, started here in Edmonton. If anybody ever drives by Davies Road, we're the mysterious red building on Davies Road. You should all go by and look at it now. So we've got all the infrastructure and resources we need to be a successful company. We've been focused on custom software projects for the most part during our 15 years, but we have also developed products as well. As I was saying earlier, one of the most notable being Pleasant Password Server, which is an enterprise level password manager used by many companies around the world, which gives us quite an extensive client base, not just in custom, but also in products. We've got clients such as NASA, the White House, Royal Family, Australian Department of Defense, PayPal. So we've got all the obligatory logos that you need when you're starting up. So I've already kind of talked a little bit about what Sheetcast is, but I think it's important to just kind of drive it home because it does typically take 1 or 2 iterations before people start to accept that it's actually going to help them build software. So using Sheetcast, any everyday Excel user can build their own custom software. And what we mean by that is actual software. It's not just presenting data from an Excel spreadsheet. It's not just capturing data and pushing it into an Excel spreadsheet. It does both of those things very well, but it also allows you to create your own buttons using Excel functions and formulas, workflows, notifications, chat rooms, calendars, maps. It's fully functioning software. Easy and powerful to use, and I'll talk a little bit more about that afterwards. It's a heavily patented product. We have invested quite heavily in the patents. I don't know how recent this list is, if I'm being honest, but there's 7 patents on here. You can see the numbers there. Not an exhaustive list. There are more. These are patents granted. There are more pending, and there are more also buried somewhere in my CEO's mind. I should just make a quick comment on the patents too. Our first patent, so typical software patents may be about a 20-page patent. Our first patent was over 150 pages. It is incredibly, from my point of view anyhow, incredibly complex and multi-layered patent. So, and that was just our patent 0, we call it. So this is a bit of an odd screen grab because none of that really makes sense. But this is an Excel spreadsheet that somebody has used to create a form page. So you'll see there's the headings on the left-hand side and these weird value colon somethings on the other side. What this is just a drag and drop where you can actually take all of your headings, drag them into a sheet, take the values that are associated with those headings, drag them into a sheet, use all the tools that you have at your disposal within Excel to lay that out any way you want to, and add other formulas and calculations around that within the sheet as well. This one's a very simple example, but what you end up with in this case is a form. So this form is being used to on a mobile device to capture field data. And you'll notice here as well, you can attach your financials. I think this is from our financial modeling software. Attach your financials, attach a slide deck right into your software. So not something that's easily done or easily managed even within Excel, but now you're not in that world anymore. Yeah, so this is from our financial modeling, I think. So this is an income statement, kind of what it looks like in Excel. I'm sure most of you have seen sheets that look like this. And when you just go to the next slide, please, Michael. Too small for the screen. But now you've got these same income statements laid out nicely in Excel. And what you can't see here is you can go in and now edit some of those formulas or some of the data. There's a word I'm trying to remember, and it's escaping me. So you can manipulate your variables and then see the new projections. So the person that built this app for us is one of our business analysts who has worked in the financial sector. He thinks this is a useful app for folks like you that are looking to invest in companies and running scenarios and being able to run those scenarios really quickly online and share them with your colleagues. Competition, I'll just talk a little bit about this. So I'm going to talk just at a high level because there's thousands of products out there that do various different things. But we think about it in terms of categories. So custom software, which is something that we do, this cannibalizes some of our business as vice president of sales. That makes me very sad. But with custom software, you can build exactly what you want. But it's expensive, it's high risk, it's time consuming, and it's disruptive. Even when you're doing it well, it's still all of those things. Off-the-shelf software is something else that we're competing with. With off-the-shelf software, it's typically much more affordable, although it can still be expensive. Typically requires compromise. I would say what you're doing with off-the-shelf software is homogenizing your business to work with the software rather than leveraging the innovations of your business to maximize your efficiencies. That all leads to having multiple systems. There's many businesses out there. I'm sure you guys have experienced some of them where they have 4 or 5 different systems. Some of them don't provide the full functionality, so they go out and buy others. Then there's the low code, no code market, where again, you can get mostly exactly what you want, but it's not always as flexible as it appears to be, because it's somewhat black box development. And there's typically steep learning curves. I'm aware of several different businesses excuse me, that have gone down this road and abandoned it fairly early on because they thought it was going to be easy, and then they realized, oh, it takes a little bit more effort than we thought. So the advantages that Sheetcast has is it's familiar. We're not asking people to learn something new. We're asking them to leverage their existing knowledge of Excel. The effort to create applications is insanely smaller than custom software, as an example. So I didn't show you the full words. I didn't show you everything in that financial modeling software that we built, but I had our estimating team take a look at it and say, if we were to build this custom, what would we charge? It's about a 500 to 750 hour project, which would be delivered by many people over months. The same app that they quoted for custom, Alex built in something less than 20 hours. And that included deciding what he was going to build, creating the spreadsheet for it, and then turning it into software. So it's not a little bit better. It is exponentially, if that's a big enough word, better. It's also incredibly scalable. So this is why our pricing model is the way it is. This is why we chose to leverage Excel, because some people know how to use Excel simply, and some people know how to use Excel quite complexly, and they do amazing things with it. It scales with your knowledge, it scales with your budget. And the market that I'm most excited about in terms of broad markets is the small medium business market, because I think this levels the playing field for startup companies, for small companies that are trying to do everything as affordably as possible, which means a lot of manual processes, a lot of paper just to get things started, and it makes things slower and more difficult. Now they can build something early, and they can continue to scale their business using that. So I'm going to say it one more time, because like I said, it took me, my CEO came into my office when he first started ideating this product, Thomas. And he explained it to me, and I said, oh, that sounds interesting. And he said, okay, I need to figure out how to explain it better. You don't get it. And he left. And this went on over about 2 months, about 7 times. And finally, when he came into my office one day, he closed the door, he says, I figured it out. I know how to say it now. And he explained it to me, and I was sitting in a chair almost identical to this one. And I leaned back in my chair. I'm like, holy smokes, you're going to be the first billionaire I personally am friends with, and you don't even like nice cars. And then I spun around and I said, everybody outside this window will find a way to use that in ways that we don't even understand yet. So it allows you to create custom software using the same knowledge and skills that you already have with Excel, and a few button clicks and a few magic words, and you've got your own software. So our ask today again is, we're looking for partners to help distribute and channel partners to work with to help accelerate our growth on this product. We think it's going to be a very widely adapted, ubiquitous type of product. We want to get there as fast as we can. That's everything.
Thank you, Jason. So we're gonna take some questions. Yeah, please.
So I presume it would, among other things, do things like simplifying the more complex tasks in Excel, like building pivot tables, statistical analysis, those kinds of things.
So to a certain degree, so our goal is not to replace Excel. It's to leverage what people already know how to do. But there are things in Excel that are needlessly complex.
Yeah.
Those are things that we have. Some of them are already done, some of them are on our roadmap in order to make those things easier and faster to do. As we deploy the product, it'll be, you know, the best apps will come from the advanced Excel users. But over time, we have a vision that eventually this will be in elementary schools and they'll be building their own apps with it as well, because we will take the complexity, the unnecessary complexity away.
I learned from. You turn on chat.
Yeah.
It's a write me code to do X.
Yep.
You get this code and you just need to run it. How does that functionality in chat GPT? Because now I don't even need to know Excel. I need to know how to type a question on a line. And I have my code.
So I also just recently went and poked around it and I was amazed. I asked it to make a meal plan for me. And it made a meal plan and then said, no, I don't like avocados. So it took that out, did it again. So it's a fantastic tool. We haven't really thought about Chat GPT too much yet. But the difference would be, it'll generate code for you. It's not going to build a complex system for you. And writing software is a very complex process. I'll often say, if you think about just bug fixing software, you got millions of lines of code. I equate it at the most basic level of, here's a copy of War and Peace. There's a comma missing. Let me know when you found it and fixed it. And 6 months later, you'll come back, you'll found it, you fix it. And then I say, yeah, but the pagination's off now. So now you got to go figure out how to fix the pagination. I'm like, oh, this is the wrong font now. So my point is, yes, you can probably get started with some things with chat, but it's still not at a point where it's going to start replacing developers yet, I don't think.
There's a number of no code or low code, especially on the big cloud platforms that really been pushing that. One thing I want to understand is, you mentioned kind of the ability of this to increase a lot of robust systems. What data do you have? How can you kind of prove that as compared to other?
So great question, because we don't have data and we can't prove it other than to sit down and show you. And so that's where a lot of our work comes in right now, is demos, and I'm having the video team producing videos as well. Those videos that you saw were very basic, you know, create a map, just to show how fast it can be to do certain things. I can tell you anecdotally, I just yesterday started building I call it a business in a box app. So I started with contact management, got that built up. Then I switched to invoicing, got some of that built up. And this was just kind of casually in between tasks I was doing these things. I figure if I sat down, and I'm not the strongest Excel user in the world, I figure if I sat down and spent, let's say 3 days, I could probably build a small business ERP, overstating the power there. Small business ERP that allows you to manage all your contacts, manage all your invoicing, your inventory, your accounting, your taxes. Probably take me about 3 days to build that app and a little bit of thinking. And then somebody to find all the missing commas for them. Yeah.
So the no-code platforms like Bubble, Flutter, you being just focused as a spreadsheet or Microsoft spreadsheet, does that limit you to compete against those guys, or do you see yourself in a completely different space?
In a completely different space, and I actually think they're the ones that are limited. Very biased opinion, of course. So the patents that I talk about, we are the only ones, based on those patents, that can take information from an Excel spreadsheet, not just data, but configuration, layout, everything that exists in an Excel spreadsheet, and convert it into software on the web, and also push that data back down into Excel. We're the only ones that can do that. The reason I think that they're the ones that are limited is because they have to function in black boxes. And that's not a bad thing. It makes it easier, drag and drop code is great. But that also means you can't get right under the hood with the fact that you're doing all your building in Excel. And we're a relatively thin layer on top of that to make the software that you want to make. I think we're actually more accessible and more flexible.
I think in respect to the time should be.
Just one more
Okay.
question.
Sorry.
So I think it's a really cool product. And to answer the question with ChatGPT, tell me if I'm wrong about this, but ChatGPT produces a code, and if it's not exactly what I want, and I think maybe this is what we're talking about, as a person who can't read the code, I can't go back. I don't know how to begin edit that code, right?
Yeah.
Whereas I think you give a little bit more control over where to edit. But my question is, your patterns seem to be about the underlying technology, right? Is there anything preventing you from using the same idea in, say, Google spreadsheets?
No, as a matter of, we've chosen Excel specifically. There's 750 million Excel users worldwide. I can't remember the number now, but some ridiculous number of businesses as a percentage use Excel. So we've chosen to focus on Excel. But really, if we wanted it to be spreadsheet agnostic, we could do that. The thing is, Excel is the most powerful spreadsheet, and any other spreadsheet tool that you use, you're losing some of that power.
Because in Google spreadsheets, the cloud does not give you
The fact that it's up in the cloud, no, not really, because remember, we're not just putting the spreadsheet in the cloud, we're building software. For example, you can, there's a function called cast set values, which allows you to create a button on your website or on your software, press that button, and you've programmed the button based on Excel formulas and functions accessing data in this spreadsheet. Google Sheets just doesn't do that. Everything that you're doing in your spreadsheet is protected. So even any IP or any particular form, there's just a lot of Excel consultants. I just came back from a virtual conference of about 3,000 Excel experts. Some of them are very protective about how'd you do that? It's an if statement. They don't really want to tell you how they did it. So all of that gets protected. You're not exposing the spreadsheet at all. As a matter of fact, once the app is built, you probably will ignore the spreadsheet itself because now you're working with your data in the application. The only time you go back to the spreadsheet is if you said, you know what, I want to automate my tax return. So I'm going to pull all the information that's already in the spreadsheet, create a new layout, new data, new calculations, and I'll have a tax one.
I think we can keep the discussion going. While we wait for Michael. Any more questions? Yeah.
So question just around kind of the size of the market, like, so how long has this product been around? Like, how many customers, like, just understanding that a little bit.
So, as I said, it was about 7 or 8 years ago when we first kind of got the idea.
Yeah.
There was a lot of ideating and inventing that went on for a couple of years and then some patent filing. We only just started earnest development about 2 years ago, I think it was now. And we're just bringing it to market now. The development was very challenging, as you can imagine. So we've got a couple of signed clients, a handful, I would say 7, I think, signed clients. But they're kind of our prototype early adopter clients that we're just kind of testing things out. But we are now going to market full force. So we're just starting to ramp up our sales efforts.
Okay, that's all.
All right, thanks a lot, Jason.
Awesome. Thank you, everyone. I appreciate your time.
Okay. Thank you. Sorry. Yeah. Oh, yeah. Great. Yeah.
So Eva is our next speaker, and I'm gonna introduce, I guess, Mr. Stuffman. Thank you so much for your time, and thank you for filling out those forms again. We'll take a minute while we just transition, and maybe in a minute or so.
Oh, no problem. I'll just chill. They've probably been here all day, right?
Yeah, we've got a lot of coffee. You want a coffee?
No, I'm good. You might have to pull me from the ceiling if I have some, right? So.
after this, we have Chaneel as our last speaker. And then we're gonna have a reception so you can relax some more. Other people can hang out. Great.
Maybe a minute more.
Are you guys okay with us coming out now?
All right, for our next presenter, I think what Mark was speaking about, ChatGPT. I think more and more professionals are realizing in the world of ChatGPT that, skills are getting outdated, so upskilling is an important aspect of anyone's career if they want to stay relevant in the market. And, addressing that issue, Eva right here with her venture, they're trying to connect job seekers to right skills courses so that they can, upskill themselves and also helping the recruiters find the right candidates. So I give the floor to Eva to present her company.
Thank you very much. Good afternoon, everyone. Is everyone still energized? Great. Okay, so everyone in this room today got here to this presentation by taking probably your favorite route. And if you're always disrupted by, let's say, road construction, oh, that never happens in Edmonton, you probably pulled out your Google map to find another just-in-time route to get here. But think of this, what if this was your way to career advancement and that route was disrupted? There really isn't a Google map to help you find just-in-time way to get to the ideal job opportunity. So what we're going to do is talk about a while back, there was a linear path from right from school to a job for 10 years, and you're just set, no more. According to Forbes, these linear career paths are now non-linear, and they're constantly being disrupted by AI, innovation, and hybrid work. Now, to that point, how many of you here have used ChatGPT recently? Hands up. Whoa, okay. By doing that, you have just disrupted the way you learn, work, and play in the future. And this is why there's a 50 billion North American market sitting here right in front of you. And that's why I started FutureCite. I saw how AI and hybrid work was going to change these non-linear paths. And that became very apparent when, with the people you see here in this slide, they were just about to graduate from school. And I was working with them on a pilot project. And he said, Eva, we sent out hundreds of CVs to firms and either we got rejected or no response. And they developed what we call fear of rejection. So for skilled newcomers, that's even a higher challenge. So they all came to me and said, Eva, please design a system that will help us navigate to find the right courses to get to the right career and then get hired. So I discovered that this not only impacts job seekers, it impacts the three communities of job seekers, employers, and educators. Now, employers and large corporations, they've got the resources to upskill and advance people internally. SMEs don't. These are small and medium-sized companies. And SMEs in the past 2 years in North America spent $30 billion to train, but yet 52% of them still can't find qualified hires. And when they post jobs, they complain, oh, Eva, I'm so overwhelmed. I put an ad in, got 100 resumes, none of them were relevant. So that's why these employers, are challenged, but also the educators. Educators are saying to me, oh, just last week, an educator said, Eva, how do we find what the skilled employers want? It's a lot of work to dig up that information. I said, yeah, but I didn't want to say we have it. We can do that for you. But because of that time lapse, they can't design the courses and update them in time to create the just-in-time courses. So, in short, there are no Google Maps to navigate just-in-time career paths and courses. And yet, it's even tougher to find just-in-time candidates that can be anywhere, anytime, except for Bob, who you all know, okay? And Bob's not on our team because he doesn't have ChatGPT or Siri yet in him. But I'm going to talk about why I'm passionate about FutureCite. As a founder and a serial entrepreneur, I've transitioned from careers and industry sectors, from A&E to biotech and digital. So I understand the market, and that's why I built the stellar team, Steve in marketing and in product development. We have Juan, Russ, and Rasha. And in systems engineering, we have Scott, and in HR, Okan. And advising us are Alex and Deidre, who have international market experience. So due to the accelerated disruptions that we talked about earlier, employers, educators, and job seekers are extremely challenged, and they have huge pain points. Thank you. Next click. We can transform that $1.7 trillion GDP gap into a gain every year in North America if we can bridge these skill gaps. So employers, they're challenged with new skill demands and can't find the right hires. Next row. Educators, because of the time lag, can't get those just-in-time courses to meet the skill demands. Next row. And then job seekers, even though they're courses, they're not sure which of the thousands up there to take that will get them to their intended job and career. Next. So this is a huge market size. It's about 7 trillion, but what we've done is we've funneled HR and EdTech down to a global TAM of 153 billion, a SAM of 50, and a SOM of 5. And our target is 100 million by end of year 5, with 3.5 million global subscribers. Yes. So at FutureCite, we're focusing on the pre-screening, pre-hire stage to bridge skill gaps and to save time and costs for these 3 users. Our AI-powered dynamic real-time community network helps employers to save costs, to improve recruitment and retention, helps educators to reduce their time lag, to design those just-in-time courses. And for job seekers, we simplify and take the stress out of career application. So how does it work? It's simple. All you do is answer questions to do a career post, a course post, or a candidate post. And then what our system does is do the match in real time without leaving the system like other competitors to give you results. So a job seeker doesn't see the job post unless there's a match. So let's say it's Johnny. Johnny sees the job post that matches him. So he opens his dashboard and he sees the skills that are needed, the traits that are needed, and everything else that aligns with the culture of the firm. And then he also sees the courses that will give him the skills that he's missing so that he can qualify for that interview. And the employer is able to see all the matches, but they also see the matches of the pre-qualified candidates that have those just-in-time courses. And the educators, with all of that information update, now has real-time access to the new skills posted by the employer and the preferences for those courses posted by the job seekers. Thank you. Now, in the competitive landscape, what you see is that we're different from the others in that we offer both careers and courses, but within our system. Many of the others go outside of the system. We also do a 3-way update in real time. Many of them don't. We also are open to all HR and EdTech. Most of them don't. And the sweet spot for this emerging white space is that we are positioned in the pre-screen, pre-hire stage to upskill and train. And with our deep personalized 3-way match of the careers, candidates, and courses within one system, the results are instant. Now, in order to build on our marketing, we build community networks through partnerships with the SMEs and their HR vendor network, with educators and their student association networks, with social agencies and their skilled newcomer networks. And we lever these community effects through outreach of social and digital channels. And we engage our member communities through network ambassadors and our co-hosts of online meetings and meetups and stories. Next. Now, our business model is a SaaS subscription model for 3 user types with both free and paid tiers. And with only the Pro Tier 1, our aim is to attain 50 million by the end of year 5, 1.5 by end of year 2, and by end of year 3, we can realize 80% gross margin, which is really interesting. And our CAC, as you can see, even though it starts at 28, it drops down to just over $2 end of year 5 because of network and scaling effects. Thanks. So we're really proud of our milestones. It's a little startup company. What we've done is we've been accepted to the Toronto Collision Global Accelerator, completed the Okanagan and the Founder Institute Accelerator, and we've raised over $300,000 in capital to fund our core platform and operations, our 3 APIs we're developing, and as well, marketing operations and our IP portfolio. In our IP mode, we have patents pending, and we also have FutureCite and the extensions trademarked, registered for North America for services and wearables. And we're proud to say that our pilot launch is in full operation. We have users on the site, and our aim is to triple the users by time of our market launch in Q2. And I just want to mention, if you see in your appendix, I sent you the chats that we have with Zuckerberg, Musk, and also amongst some of them. Next. So we're really excited about this chart. This is our market growth opportunity, levering both Pro Tier 1 and Pro Tier 2. And that we want to attain 100 million by end of year 5. And we will do that with strategic partners in the 3 value enhancing features we're adding in analytics, wearables, and advertising. And you notice that the CAC is the same with the combination of both tiers as they were with 1 tier due to our network and scale effects. Okay. So for the milestones for our funding, we are looking at the pre-seed round and the seed round so that we can accelerate our market access across Canada and into the US. And in delivering that, we're looking at launching our 3 APIs in parallel with our go-to-market strategy, ready for a Canada-wide launch in Q3 and into the US by Q1. Next. So today, we're looking at 500,000 investment. And what we're going to use the proceeds in is to scale our internal team, our systems, enhance our IP mode, and launch the market. We're looking at securing 3 partnerships and securing 100K in revenues on top of that, along with 100K in grants. We're being very conservative with our estimates. Thank you very much.
All right, we'll start the next segment with question and answer. Oh, I think you'd like to.
Question, the rating 500 for the valuation. Second is that it's still share, Udemy for the world, a lot of content, the creators who create courses. How do you get that kind of a content, so many diverse skill sets?
Oh, okay, perfect. Evaluation, well, we'd love to have your valuation, but let's say 3 million, that's negotiable. In terms of Udemy, we love to work with people. Udemy was a graduate of Founder Institute, same as us. And so we could get a quick intro to them when we're ready, but they're the perfect, we would curate certain courses. For example, I showed one sector construction, because that's going to explode, especially with AI embedded. There's a lot of upskilling there. So there's many post-secondaries that are starting to offer, but Udemy's, the Coursera's of the world are what we would curate for our users. When we see the data, we'll say, oh, we need this course. And so that's the market pull for the educators to post. So what they do is they answer the questions and they post the content, and then they link it to the application to pay at that site, at the educator subscriber site. So we don't take a cut of the educator's margin. We do a SaaS subscription. So that's how we differ. And so it's very affordable for them to do that and very scalable for us. Our system is set up to scale.
As an educator who develops course materials, I'm loath to change, because I can't be chasing the next thing, so there's a certain list of reasons. Until I'm sure that my students need to know how to, write code to pull API as well as other ways to do it. I am not altering anything I'm doing, it's expensive to change a lot. So how do you get educators on board, especially since you're a big grow out of this, that it's this rapid change? I hate rapid change. People don't post that.
Yeah, yeah. It's a real pain. I hear that from everyone. So, but some post-secondaries like Nate's doing it, Norquest is doing it, but they're not taking away from their like 2-year programs or their 1 to 2 year programs. What they're doing is they're looking at the continuing ed side and they're saying, what courses do you need that can augment what you've already taken in post-secondary? Yes.
Okay, I'll follow up on you very much.
Sure. I love answering questions.
I have a little bit of a follow-up on that. Like, you have 3 kind of different customers, right? And they're all kind of looking for different things. And so I guess one of the questions I had, and when I spoke with companies that are kind of looking at this job hiring process, it's like the individuals that are looking to secure the job, right? Once they get the job, how do you kind of keep them in the platform or keep them engaged? And how do you stop them from being like, yeah, thanks, got a job, and now like.
Wonderful, perfect question. We offer, like, job seekers get on our site for free for life. And what we mentioned in terms of engagement, we have what we call our networking co-hosting meetings, where we have employers co-host the meetings and talk about what's new, what's in the industry, what's coming up. The current one we have right now is on the H2 economy. So in that co-host panel, we've got Edmonton Global, ATCO, and CFR, and then many other industries coming in. So what they do is we invite all the job seekers and we invite employers and educators into that networking room after the panel speech, and we share notes. So just with one meeting, we had 2 people. One just launched a company with 10,000 orders through that networking meeting, and another one who just got laid off from accounting, found a job. And so she phoned me and said, I want to put a testimonial on your site. When the time was right, I said, yes, so it works. So it's not just the AI, it's the human interaction. And because what we do is we listen carefully to what the employers want. So for example, if you wanted, let's say, didn't want to change your curriculum, but you're saying, okay, if this employer wants, let's say, a new version of ASP.NET Core, I'm not going to change what I'm going to do. Go here and get it, but my core area stays. That's okay. Because eventually what's going to happen with the micro-credentials, according to Holland IQ, is that the post-secondaries will play a big role in that because you're financed by government and you've got money. But meanwhile, the Udemy's of the world, the Coursera's are out there saying, okay, we can do our courses, but now we also want to collaborate with university in developing these micro-credentials. So what we do is we basically will say, hey, we need these courses. Who has it in the right time? Because we can see from the data whether or not the job seekers are looking for a part-time, or maybe even a small business employer wants to send their person in and they're saying, I can only have them on weekends. So if you are a job seeker, you can put down your preferences of time, like we go really deep. Like all of the data we have on our site does not exist like on Indeed. We did in our research project with the scientists, we scanned 10,000 job posts. You know how many had what we have in there? Almost 0. Less than 1%. And Indeed's one of the biggest job sites in the world. Okay, so we know we've got something here. So that's in our patent. And the other things we're doing, we can't really talk about because we're also looking at what's coming. And the good thing about our timing window is that everything that's been designed 2 years ago, throw it out. ChatGPT, Microsoft, Google just changed all of that. And they're telling me all of that underlying infrastructure is going to change, so get ready. So we're just right in the nick of time. Rasha and Scott, who are on my infrastructure team, they said, I said, watch NVIDIA. Because when NVIDIA comes out, we'll know everything of what's going to happen for the next 3 years. So that's where we're going. So our timing is really perfect in terms of the crescendo on the building on the IP to solve the innovation window.
I think we're almost on time. I would like to create every all-day writers platform.
Thank you.
Your group presentation.
And if you want to ask me questions after, I'm around.
Okay.
And I'll take Bob with me.
After a minute's break, we just have one last candidate and we should be end up. Thank you.
Staples, it looks like.
None of them work.
Buy that. Yeah.
Forget about.
Everybody is impressed and they want to get out of here as soon as possible. And I have to be here pitching. No.
I think it's fine.
Take a minute to like everyone, okay, let's settle, let's keep it where you can sit down, this is the last segment, and then after that we go for the straight. I'll just, whenever Michael comes in, it's gonna set. Yeah.
So about 2 minutes for people to get their forms set up because we do a little evaluation. Hi there. I think we've lost, we got 20 people here. Do we got 20? No, I got 2 people here.
It's 2 people, but
I got me and me.
I think we can keep recording this, right?
Yeah, we're just gonna keep on recording this and that's great. So we've had a pretty long day. We started at 9 o'clock.
Yeah.
And so, but I really appreciate you presenting and people over here are serious and the video will be recorded and shared. And we'll continue to try and help connect you.
So great.
Okay, I'm gonna.
I hope they are not too cranky after the long day.
No, we keep in fact,
We're in very good moods, don't worry, very good.
Where's your presentation actually? Do you send it?
I thought you already have it.
Okay, did anybody accidentally keep one of these? Bathroom cards? Maybe you can give it back over there. Let me just get sure. Oh, we got you.
I would say I have exclusive access to them.
We know everything now. Okay, great. Thank you. Okay, so when did you know?
It was in the form and then
Oh, okay, so.
the other
it's in the
person said
room.
they actually put it on the pitch.
that's great.
They read my pitch deck.
Yeah, then I should have it. Did I have video or anything complicated?
No, just simple slides. And I'm actually okay pitching without slides, so.
That's a good sign.
Wow, that's excellent.
Good sign.
And that might be more easier for me because with the slides, I have to fit exactly into the content of that.
Well,
But when I'm just talking, I can just talk.
let me see if I can help you out. with
Yeah.
that. I might have condensed it,
Oh, okay.
a little bit here, but let's see, should be in here. Okay, do you have it on memory stick?
I have it, the laptop here, if I need to
No,
connect
just
it.
make sure, I just need to find the form. It's on this computer here. It's from. This is an old computer, so I'm just.
So I updated through the system.
Yeah, let me just put the email.
If you want, I can mail it to you right away.
Oh, yeah, maybe do that. Yeah, just in case.
The speed is.
PowerPoint file or PDF file?
Whatever.
I think
Have it. Yeah, it's my last name, Oversduin, U Alberta, CA. Here.
Actually, I should be addressing a doctor over there, but.
Oh, that's quite all right.
Are we ready? No.
I have to go through my spreadsheet, which is so slow. It's on
Oh,
the cloud, and the cloud is not.
Sorry. We were.
What's it? Oh, okay, we are, yeah, 2 minutes to remain here. Okay, so the, great. 4-minute download. I'm really sorry. about
There's
that.
no video, but still.
Well, no, that's not your fault. The Wi-Fi is a little slow here. Get used to high Wi-Fi speeds.
All right, okay.
Well,
Are we still waiting?
it says 20 minutes for download.
Okay.
1 hour now.
I can start without.
Do we have it in the?
Well,
drive?
I have it in the PDF file as well. Maybe that's easier.
Okay, yeah, just, we'll just get it done right, so we don't have to, screw around too much. You don't have a number sticker.
Sorry. Unfortunately not. So I sent the PDF version, which is a much smaller, 4 megabyte.
It is actually, it's a good idea. Let's see, that might be quicker. It's just a little sleepy today.
Oh.
Descriptors. Look at the website.
I think,
How about we just start without making people any more angry and tired? And then once the file loads up, I can just reuse it as reference. I don't have any video, but it's just a.
Oh, we're
slides.
almost there, 1 minute away, 5 seconds. All right, gentlemen, good news. We have with,
Thank you so much, everyone, for sticking with us. For those who have been here since 9 a.m., it's been a long day, and I'm sure it's going to be ending on a very good note. Before introducing, I think we should talk about something around batteries. I think one of the, if you ask any futurist or innovator, like they, which industry has not seen the innovation that every other industry has seen, its batteries, right? We haven't seen that sort of innovation or scale as we are seeing in any other aspect of our lives. And obviously there are various reasons, but we have Chaneel Clarke over here. He's the CEO of MakeSens, who's looking to disrupt that and make that possible. I hand it over to Chaneel for the presentation. Thank you.
Nice to meet you, everyone. My name is Chaneel Clarke, CEO of MakeSens. And sorry, is that the clicker I can use?
just tell me.
Oh, okay, yeah. So I'm here today to introduce who we are and what we are doing to change the society in a good way. So right now, if you are trying to buy an electric vehicle, I don't know if you ever have bought one. Other than the cool design of the car, what are the four things you want to look at first? Probably you want to see how much of a distance it can go before charging it up again. You want to know how fast it can charge the battery, and you want to know how small the battery is, so that how much of spacious cabin you would have. And also you want to know how expensive the car is. So these are the four things, but they're all, not everything is related to just the battery, but they're mostly related to the battery and depend on the battery. So what is the problem right now? Well, there are many reasons why Canadian doesn't want an electric vehicle yet. Maybe the cold weather is one thing, but major problems we have right now is the low battery capacity. Some good models now, they claim that they can go 600 kilometers with one charge, but Canadians think that's still not enough, especially because we don't have good enough platform of electric vehicle chargers everywhere in the country yet. We don't have that many, so they want to have a longer distance or range of vehicle from one charge. And also some people criticize that electric vehicle is just a shenanigan because there are definitely greenhouse gas emission coming out from the manufacturing of batteries especially. So because of that, we need a new type of battery that can increase the energy density so it can go further distance in the same vehicle size, and also manufacture that in energy efficient way so that we can generate less greenhouse gas. So the opportunity is here. We are proposing new type of battery using silicon as the negative electrode material. So silicon, compared to the conventional graphite, which has been the material for the battery, they have more than 10 times the capacity in the same amount of mass. And they so this can actually convert into 20 to 30% increase in the driving range. Why not 10 times more? Well, that's complicated because battery is not only made out of a negative electrode, but I can explain more about that later. It'll be safer and lighter battery compared to what it is right now. However, there are some challenges. The silicon battery has been studied for past 20 years, but it has not been yet commercialized in a large scale. The reason is that silicon has some critical problem where it has this 400% of volume expansion while it's charging and discharging. So this can cause rapid degradation battery because of so much stress inside the battery. And it is also manufactured, the silicon battery is very expensive because of a problem like that. You can solve the problem, but the suggestions right now are very expensive to manufacture and they are not scalable. So our proposal here in our technology is that we create a multi-layered structure to make sure the silicon is not degrading over the cycles of charging and discharging. And this manufacturing, the manufacturing of that material is actually very simple. Our manufacturing process, it's very, very fast, especially because we are using photoelectromagnetic irradiation process instead of a conventional heat treatment. In this method, we actually, each individual process only takes a few milliseconds, but it is applied in repeated cycles. So we are saying about 5 seconds. This manufacturing process is actually 70% more energy efficient compared to the conventional method. And this method, as I mentioned, we can increase the capacity of battery up to 40%. I'm sorry, I was like 20 to 30%, but we can theoretically increase it up to 40%. And this process we've been considering it such way that it is readily applicable to the existing manufacturing line for the battery. So any battery manufacturers who are manufacturing battery in large scale, they can take this material without changing anything in their battery manufacturing line. They can apply it right away and have increased the battery capacity. So our advantages, just in performance, we have compared to the different competitors, and our battery has four different categories. We are better in initial capacity. Our battery has a higher retention rate in 100 and 2,500 cycles. And then we have also seen that our battery has a relatively high initial Coulombic efficiency. That means in the first cycle, how much energy you're losing, because after the first cycle, battery becomes more stable after that. And then there's the process is an energy efficient process, and it's also low cost of manufacturing process compared to the other people who are using very large scale, very expensive manufacturing process or very expensive material to manufacture them. Okay. Right now, we have one registered patent and five pending patents, and then 3 developing patents. And thankfully, I just received the news yesterday from our patent lawyer that 4 out of the 5 pending ones have been registered. Now, these registered patents, unfortunately, are not registered here in Canada yet. They are all registered in Korea right now, South Korea. The reason is that we have a partnership with a South Korean company right now. So to make sure that we don't have any problem in the later stage, we just wanted to have that patent in Korea first. And then we are patenting them before September this year, here in Canada, USA, Europe, and China. Okay. Right now, we have verified our sample, and we have seen very promising results as I presented, but that's in lab scale. So when we have actually contacted our potential customer, who's large-scale battery manufacturer, they've told us that's great, it's very promising, but we want to see how they do in commercial scale battery. So in a lab scale, it's a coin cell that goes into your watch. And they want to see that in actual cylindrical cell or pouch cell that goes into electric vehicle. Fortunate part is that they will not do it for us. We have to find someone who will do it for us, the test, and then we have the partner who's going to do it for them. The problem is that the partners, for each individual sample, they need 500 grams of material. But right now, in our lab scale production, we only produce 30 to 50 grams per day. So if we do nothing else, just produce the sample material, we produce 500 grams in 10 days, which is not very good for our research and development of the product. So we need to scale up to the pilot scale as soon as possible. That's capable of 100 kilogram sample per month. So approximately 3.3 kilograms per day. And then for that, we are trying to secure $2 million investment this year. And then by next year, we want to have the technology verified in that pilot scale and then in actual commercial line as well, so that we can have the conversation to have a sales agreement with our potential customers. By 2025, we want to establish the commercial scale. Now, this will not be, unfortunately, established right here in Canada at this timeline. It'll be further in the future timeline, but it'll be established in South Korea with our strategic partner. And then in 2026, we should be able to enter the market. There is a really big market for battery everywhere, but I don't want to give you false hope saying that we'll take over the entire battery market. Now, we want to just limit it to the silicon battery market, and silicon-based battery market, according to some market analysis, we have seen the market size of $3.3 billion by 2030. And with our plan of target entry to the market, we are being realistic in how much share of the market we are going to be taking and how much of revenue it will result in. So by 2030, we'll be looking at revenue of $133.6 million with approximate profit of 25% of that. Okay. Well, as you can see, the North American market is also expanding really rapidly with the expansion of all the other markets in the world. But especially here in Canada and USA, we have a bigger opportunity because of IRA and then similar law being trying to be registered here in Canada as well. So we will be having the facility here targeting the manufacturers here in Canada and USA. Right now, our co-founders are composed of 3 people coming out of the same research group from the Dr. Simon Park's group at University of Calgary. Dr. Simon Park is not only a renowned researcher, but he has founded 3 different companies already prior to the establishing MakeSens together with us. We also have, the next slide, very renowned researchers from different universities in the world here in Canada, from India, and also from Manchester University in UK. And we also have a technical supervisors or advisors coming from Georgia Tech and KAIST. Not only that they are coming from renowned research institute, but they are actually collaborating with some of our potential customers, SK Innovation and LG Energy Solution. They are some of the biggest battery manufacturers in the world. And then they are giving us a very good advices on how we make sure we please our customers when we are designing our product. Sorry, can you go back to one slide? Yeah. Also, we have a strategic partner, VitroCell. They are the one in the South Korea who's going to manufacture these commercial scale batteries for us to test it out. And we also have some funding support from MyTex, Technation, and Eco Canada. We also collaborating with Innovate Calgary a lot because our intellectual property originally came from University of Calgary, which has been in agreement with Innovate Calgary. Thank you very much. That was the very short summary of everything we have so far. I'll be very happy to answer any questions you have here today. Thank you. Starting questions? We have time.
So have you actually solved the expansion problem now?
In the lab scale, yes, we believe.
And what's the energy density of the battery compared to, say, the lithium-ion?
Oh, it is lithium-ion battery, but out of the lithium-ion battery, conventionally people have been using graphite as the negative part of the battery, and we are only changing it to silicon. So graphite is about 372 milliampere hour per gram. Our material with silicon itself is a 4,200, more than 10 times. But when we do all the processing we need to do to stabilize the silicon, we are looking at around the 1672 right now.
Wow, so quite a bit more.
Yes.
So you're looking for $2 million to build a plant, to build enough of the silicon.
Yes, and they're very high.
What is that plant or that output good for if your batteries don't work?
If the batteries don't,
Yeah, suppose battery doesn't work. Is that plant good for any, can it be repurposed? Can you make something else in that plant?
yes.
Tortillas, I don't.
Yes. So basically, it's a pilot scale lab scale. And even though we'll be doing production of 100 kilograms per month, but it can be easily repurposed to any other process. So right now, we actually have ideas for future markets. So some solid state batteries could also use this silicon type material, but we can utilize this technique of encapsulation of material and the processing the material to any other material. For example, we not only looked at this anode material, but we also looked at some potential apply for supercapacitors as well as cathode material for batteries. Yeah.
It's hard to raise money.
Yeah.
For a physical plant, especially if it's single purpose, because something don't know an anchor.
Yes, I understand. So what we are trying to do is that $2 million. The $2 million include the operations and wages for everybody and materials and equipment. So we are actually not buying a facility with that $2 million, but we are trying to rent it. Yes.
That's it.
Yeah.
So, I wonder if you can talk a little bit about what you see as the biggest risk from a scaling perspective with your process and what you worry about.
Biggest risk right now is that the cost of raw materials.
Yeah.
Because right now, especially in terms of Canadian raw materials, because I know that there are many Canadian companies who are still similar to our stage. For example, silicon is the main source of our material. Right now, we are getting supply from South Korea right now with our partner. However, if we are trying to get that supply from here in Canada, there's one company in Quebec that's doing that, and then they haven't still scaled up yet. So if we can get some sample out of them, it's very, very expensive. and we don't know how much it'll be after the scale up. So that's one risk we have right now. Yes.
Does this partner sit on your cap table? Do they have Asian rights to your product? Where do they sit in terms of, what are they gonna eat relative to one of your investments?
Okay, sounds great. So right now, they have initially invested in us of $800,000 to bring us to this stage from the scratch. And then that was 44% of the share. And then they do have share of intellectual properties. We are sharing our intellectual properties with them. But our contract with them is that whenever, so we did that contract because initially we didn't think we would be producing this material here. We are thinking of licensing the product there, but instead of licensing, they are sharing the IP, and then whatever they're manufacturing and selling, we will be sharing 50% of profit. So it goes either way. Whenever we are manufacturing and selling, 50% of our profit goes to them. 50% their profit from selling from their side also comes to us.
So just clarify for me, who owns the patents?
It's shared by us, MakeSens, and the FutureCite, our partner.
Who's it assigned to?
Yeah, it's assigned to both companies.
Two assignees on the patent?
Yes.
Okay. All right. And do you have a prototype? How bulletproof is it in the temperature or pressure or the kind of stresses that it might in extreme Alberta weather, let's say, face?
Unfortunately, we haven't tested on the temperature difference yet.
Just curious, like, why do you want to focus on Canadian market, but you can, maybe focus on other markets that have adopted electric vehicles or?
We're not focusing only on Canadian market, but we're focusing on both Canadian and US markets, the North American market.
Right.
Because it is the largest consumer market and it has the smallest percentage of existing electric vehicle compared to any other continent at the moment. So the market potential for transition to electric vehicle is larger than any other continent. Plus the consumers' purchase power here is also very large.
Do we have any last questions? All right, thank you so much. Michael.
Thank you for sharing. Thank you, all of you, for staying this long. I know you must be exhausted. We do have some refreshments. You can fill out your form first or later, I guess it's fine. There are refreshments out there, and feel free to share your contact details, follow up those connections. That's what makes this work, is that you can find one person that can help kind of link up or make some suggestion on how they can improve their plan. That would be really appreciated. I do want to thank all of you though sincerely for coming here and for the University of Alberta for supporting this, our investors for advising the teams. But I think because it's been a long day, we'll close whenever you're ready and continue the conversation over drinks out here.
Thank you very much. Thank you so much. Thank you, everyone. Good job.
Are you connected with like companies at least like Novonix, like guys that are doing materials?